In order to understand the necessity of neuromuscular reeducation, as well as assess potential muscular conditions, I would like to refer you to these pictures. On the first picture, we can see muscles in the normal resting tone. The physical manifestation of the normal resting tone are the absence of discomfort, tension or restriction of motion, and the absence of having an urge to massage this particular muscle. On the second picture, we can see a muscle with a higher resting tone. As you can see, the same muscle is shortened and widened. In this case, the person can experience a little discomfort. At the same time, we can expect that the muscle will demonstrate some degree of insufficiency during stabilization and movement action. This higher resting tone of muscle can result from physical and/or emotional overload. Irritation of spinal nerves can also initiate the reflectoric higher tone. This insignificant higher muscle tone has to be addressed. Otherwise, muscles will gradually accumulate tension to the point that microcirculation will be disturbed and penalizing system will be activated. Consequently, the person will start experiencing pain and limitation of range of motion, along with many more dysfunctional attributes. In such case, we can say that this particular muscle will demonstrate insufficiency in movement and stabilization of region, which in turn will contribute significantly to the instability of the joint. Additionally to the functional insufficiency that these muscles would sustain, if this painful stage of muscular abnormalities would not be timely addressed, the muscle could develop a hypertone condition with the pathological changes within the muscles. Usually, the higher resting tone of muscles should be addressed by receiving massage or by constant warm-up routine. In picture number 3, we can see difficult muscular pathology. As we know, muscle mass is composed by muscular fibers. In this case, partial fibers of the same muscles accumulate much more tension than other part of the same muscle, which make this part of the muscle shorter than the rest of the fibers of the same muscle. Any attempt that will cause muscle to participate in movement or stabilization will also cause the overtense part of muscles to be disproportionately overworked. In this case, massage alone or regular stretching will not help. If this difficult pathology will not be adequately addressed, it is very possible that a person will suffer a significant muscular tear. As a matter of fact, the constant overwork of this part of the muscle will lead little by little to the partial microscopic muscle fiber tears, to the point that one day the most insignificant movement can cause a massive partial or complete tear. In this condition, not only will stretching not be helpful, but to some degree it can aggravate the abnormality. At the time of maximum stretching, Golgi organ that located in the tendon fires electrical impulse that cause muscular relaxation. With this pathological change in the muscle, this impulse will bring relaxation to an unstressed part of the muscles and will not affect the pathological changed part. The cure will come in the form of the post-isometric relaxation techniques. In order to explain what the post-isometric relaxation techniques are, we first have to discuss types of muscular actions. The muscular actions are divided in several types: isotonic, isometric, and other actions. Isotonic action is such when muscles contract with no extra load, gradually shortening and transmitting the power to sustain the movement. Isometric action is such when muscles attempt to contract, but because it's countered with the equal force in opposite direction, it cannot produce any movement. As a result, the whole muscle mass is forced to stretch in order to fight this resistance.
When we perform post-isometric relaxation to determine the maximum range of motion. Even if this limited, we have to see the maximum. And let's say here, this is the maximum range of motion, and we will a little bit to 30-35 degrees. We will move the we'll open the angle to 35 degrees, and we will ask gradually our client to push against our hands. Gradually push, more. And when we reach the point that we feel that is pretty strong, or for us difficult even to resist, we will ask him to stay like this, and after 30 seconds approximately of isometric tension, we will ask him to relax, not to push. To relax, not to push, totally relax, and after this, with inhale and exhale like blowing at a candle, totally relax, and we will have to be isometric tension, no isotonic, no dynamic movement. We hold like this 30 seconds. And relax, totally relax. We will ask him from this position. The other approach to do isometric tension, if your client physically is stronger than you and a lot, you can use bed sheets and in like this form, you putting him in a position that his maximum flexion normal and like 30 degree less. You controlling totally situation. You're putting like this, your hands, and you ask him to push against. Push, more, and external rotation movement. Now, in this case, we just will ask our client to relax totally, and we will try how much free of pain. If there is some pain, now if I move, for example, to a certain point and he feels pain, I will move a little bit 30 degree, and I will put his thigh against my chest, and here is two choices. I can from here to hold, or just from here, and I will ask him to push against my chest like this direction. Yeah, like this. You see, there is tension already created. Inhale and exhale.